Pay close attention. What you're about to see is Bible prophecy being fulfilled.
Welcome to another edition of YPN News, bringing you news as it relates to Bible prophecy and foretold by Yeshua Hawkins. Well, of course, the coronavirus is continuously in the news, or as it's called now, COVID-19. That is, in fact, putting a stranglehold on many of America's and the world's largest cities. It's also causing a surge in unemployment rates. We're seeing an increase in the death toll, and even the United States president is pointing the finger at China as being the culprit for what the world is suffering right now. Well, the mayor of the largest city in the U.S. is recommending that everyone going out in public cover their nose and mouth with a bandana, mask, or scarf. This dramatic shift in guidance that's in hopes of slowing the spread of the virus was utilized by LA's mayor, and the United States White House is also considering suggesting it for areas that are considered hotspots for the virus. This after confirmed cases topped 1 million worldwide, with a quarter of those cases in the U.S. and over 5,700 killed here in the United States as well as a result of the virus.
Unemployment rates dramatically increased from 3.38 million on March 21st, almost doubling to 6.64 million on March the 28th of this year. Now, earlier this year, unemployment rates were in the thousands, and now they're surging into the millions. Some are saying that unemployment is the second epidemic, with more than 900,000 Californians filing for unemployment last week. Now, New York had a 358% spike in claims. That's over 366,000 people, along with Florida, Michigan, New Jersey, Pennsylvania, and Ohio, each reporting six-figure job losses. Extremely high.
Yeah, that is. Well, Jill Schlesinger, ABC Business News analyst, said, "We don't have a playbook for this, and economists are scratching their heads because we've never been in this place before." Well, many jobless people can't even get through overwhelmed state systems as the systems keep crashing due to the high demand for claims. This means the numbers will definitely increase in the days and weeks to come. Calls to New York City unemployment hotline also skyrocketed 1,600%.
Well, departments of labor employees are worried, as are the many people lined up at food banks around the country. But for now, experts say that they expect it only to get worse.
Well, New York's Governor Andrew Cuomo spoke again regarding the latest update for the COVID-19 spread, and informed the public that the rate of the infection is going up and peaking higher and sooner than expected. The apex could be 14 to 21 days away, he said, and the need to increase hospital capacity is of utmost importance to meet that demand. Cuomo is asking hospitals to increase their capacity by 50 to 100%, from 53,000 beds to 106,000 beds, but he said the need is actually for 140,000 beds. That, along with masks, PPE, and ventilators, with ventilators, he said, being the most critically needed.
Well, so far the state has 7,000, but they need 30,000. Now, people who are under respiratory distress, making the difference between life and death for those people. The capacity of equipment is limited as they're not manufactured very quickly. Cuomo said that they're working to experiment with splitting the ventilators to supply 2 patients at once. He said this was needed because, quote, life is options and we don't have any other options, end quote.
Well, governors in the United States have been left to decide how to combat COVID-19 in their states, and of course 42 states in the U.S. have put out stay-in-place, stay-at-home orders, in effect affecting 95% of the population. Florida, Texas, and several other states have been late to issue stay-at-home orders, and people in those states have traveled further to places within their states and other states, according to cell phone data, creating an increased fear of spreading the virus even further. Because there is no nationwide mandate, it's creating a lot of confusion when it comes to the rules and their enforcement.
Dr. Anthony Fauci said regarding the nation's efforts, we can do much, much better than we're doing right now. Meanwhile, Arkansas governor defended his position to not issue a stay-at-home order, saying, if I issued a stay-at-home order today, tomorrow, 700,000 Arkansans would get up in the morning and go to work, but you would also put a couple 100,000 out of jobs.
So they're going to do what they're going to do anyway.
Right.
Yeah. Well, India's Prime Minister Modi has just issued a nationwide lockdown that will affect 1.3 billion people in India, which is the world's second most populous country. India has reported that more than 500 infections and 10 deaths have transpired. Modi said in his public address, the country will be in a complete lockdown in order to save the citizens of India and in order to save yourself, to save you and your family. Today, he said at midnight, there will be a complete ban of venturing out of your homes. Every state, every territory, every district, every village, every locality has been put on lockdown.
Well, we're now going to turn to our field correspondent, Larry McGee, who has continuing coverage on the COVID-19, actually giving us a report globally on this health disaster that is gripping the entire world at this time. Larry, what are the details from across the world?
Global leaders remain in the dark concerning the noisome pestilence of the coronavirus as the invisible masses of the grievous plague continue to march forward, expelling lives in place after place in vomitive fashion. Serious questions must now be asked concerning the immunological health of nations like Italy, where an additional 650 people have succumbed to the virus in a 24-hour time period, bringing that nation's death toll to 5,400. That number is an equation made up of hundreds of deaths per day and chaotic, overfilled hospitals attended by overworked physicians who are in many cases desperate to help but unable to. Spain is also still suffering significant losses, and for that they have extended their national lockdown for an additional month. Germany has reduced the number of people able to gather in outside spaces to 2, and similar urgency is being exercised in areas such as Paris. The Olympic Committee announced a cancellation of its festivities due to the virus is out of the question, but they are in deliberation, and the quad-annual celebration to the deities of Olympus might be facing postponement, pending further announcements. A further tragedy concerning the affliction that currently has everyone's attention are the doctors attempting to save lives, but losing their own in the process. The virus's emetic intentions has shown no partiality towards the gods of academia. As the grave consumes their patients, death is also feasting on the physicians. So much so that one physician, Dr. Laura Usick, stated to reporters that for her, going to work feels like a sheep going to slaughter. Healthcare workers contracting the blow is now being called an epidemic within an epidemic, with as many as 700 workers testing positive in Boston alone. The high infection rates are being attributed to heavy levels of occupational exposure, coupled with the scarcity in personal protective equipment born from the intensity of the crisis. There have been intense confrontations between police officials and citizens expected to abide by new quarantine restrictions. In impoverished townships in South Africa, for example, where quarantining means abiding in a single room with 6 people all day, citizens have been very reluctant to comply. In India, the curse has created large droves of unemployment. Internationally, the plague is reported to have struck over 700,000 and is being reported as peaking in some areas. For YPN News, I'm Larry McGee. Katan Jeff, back to you.
Well, it's definitely an all-around disaster from everybody, from the people who are working, trying to help people who are victims of this virus, as well as the people who are actually suffering from it and seeing their loved ones die as a result of it, and in some cases, not even being able to be around them, to give them some comfort in the very last moments of life. It's a sad situation all around.
Right, death toll continuing to rise.
That's right. Well, the United States has surpassed all other countries with the highest number of COVID-19 infections. The Pentagon is trying to acquire 100,000 body bags, and White House officials are saying the virus could claim more than 200,000 lives in the country before it's over. Now, more than 1,000 died in one day this week, the highest daily number so far. Hospitals, morgues in New York are overwhelmed. They are bringing in refrigerator trucks to store the dead in.
Now, into the second month since the outbreak reached the U.S., the nation is bracing for the worst. Trump is quoted as saying, "I want every American to be prepared for the hard days that lie ahead." Now, the governor of New York thinks a peak will be reached in 7 to 21 days as makeshift hospitals are being set up all over New York City in the Javits Center, Central Park, and Tennis Center, just to name a few.
And now hospitals are facing a growing concern, the fear of running out of personal protection equipment, or PPE, as well as medical supplies like the much sought after ventilators. Governor Cuomo said in a press conference, it's like being on eBay with 50 other states bidding on a ventilator. And you see the bid go up because California bids, Illinois bid, Florida bid, New York bids, California rebids. He said that's literally what we're doing.
Well, the mayor of New York City, Bill de Blasio, appealed to veterinarians and plastic surgeons through the news media saying, if you've got a ventilator in your office, in your operating room, we need it now. It should not be sitting there doing nothing.
A crisis of another kind is forming. As the nation is asked to stay at home and keep COVID-19 virus from spreading, 9.9 million Americans have filed for unemployment in only 2 weeks' time. And millions more might be out of work as well, because states are overwhelmed with all the new claims is just coming in rapidly. Economists warn this unprecedented pandemic could lead the country into a severe recession.
Well, the leading U.S. expert on this outbreak, Dr. Fauci, has said this is going to get worse before it gets better. Lawmakers are pushing for another $2 trillion relief bill. However, this next bill might focus on an infrastructure package. Now, it would put people back to work while upgrading the nation's road, broadband, and water systems. The ink has barely dried on the last $2 trillion deal, so reaching an agreement so soon will be tough.
The president had hoped to end the preventative measures like social distancing, by Easter, but has now extended them through the end of the month. Even so, the coronavirus continues to spread, and some officials are cracking down harder to enforce restrictions in their own states and municipalities. Some are questioning if the government crackdowns are endangering America's First Amendment rights of religious freedom.
Well, one pastor, Rodney Edward Brown, was arrested for holding a service at his megachurch in Tampa, Florida. Top lawyers at Liberty Counsel are representing Brown and argue the pastor's church went above and beyond to make the service safe. Now, counsel Matt Staver told reporters this church required a 6-foot distance, it required sanitizing, it required the wearing of gloves, and also had purchased over $100,000 of special high-grade air purification systems.
The mayor of New York City has threatened to shut down churches or synagogues that continue to hold services, and now President Donald Trump is warning congregations against congregating, saying, well, my biggest disappointment is that churches can't meet in a time of need, and yet if you do that and you do it close, you're really giving this invisible enemy a very big advantage. So he'd like to see people be able to get together and to receive that spiritual closeness or guidance, but we have this concern with the COVID-19 and the social distancing making it difficult.
Well, Todd Starnes, a religious rights reporter, told CBN Newswatch there was a frightening police presence outside an Illinois church. Starnes said the local police department showed up and they were actually counting cars in the parking lot and they were photographing license plates of people. We have a report from Louisiana where they were told that if they did not shut down their services, the National Guard would come in.
Wow. Mr. Staver says authorities should not only guard people's health, but their religious rights as well. He said This is a major constitutional issue that we have to balance with a scalpel, not a chainsaw, when it comes to protecting public health and safety. There's a way to do both without sacrificing either. Some states are deciding not to use law enforcement on churches. Ohio Governor Mike DeWine said, "I didn't think it was really proper for governments to infringe upon people's First Amendment right."
Well, a spokesperson for the Chinese government recapped the decisive actions that the country took regarding the COVID-19 outbreak. She stated, "COVID-19 is a new type of virus that we have never seen before. It takes time to discover, study, and detect." After receiving the first report of 3 or 4 suspected cases in Hubei province on December 27, 2019, the Chinese side carried out epidemiological research on December 29th, and Wuhan's health commission issued an emergency call 1 day later.
She went on to explain how China's National Health Commission sent experts to Wuhan on December 31st for an on-site investigation. Now, on January 3rd, China officially reported the situation to the World Health Organization and other countries around the world, including the United States. Next, China's CDC uploaded the virus sequence to websites on the 11th, and just 12 days later ordered Wuhan to shut down.
Well, she concluded by saying China has taken unprecedented, comprehensive, thorough, and strict measures to control the spread of the coronavirus. According to the World Health Organization, China's measures have greatly protected the interests of people all over the world. And really, despite China's super strict measures and, as they just mentioned, very thorough, there are still people that are blaming China for creating the virus, saying that the virus started it there, actually calling it the Chinese virus. And our next clip we'd like to show you here is President Trump actually doing just that, saying that this is China's virus. Take a look at this video.
From recent studies, we know that the transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood. So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary, you don't have to do it. They suggest it for a period of time, but this is voluntary. I don't think I'm going to be doing it, but you have a lot of ways you can look at it as follows. The CDC is recommending that Americans wear a basic cloth or fabric mask that can be either purchased online or simply made at home, probably material that you'd have at home. The new mask guidelines also do not replace CDC's guidance on social distancing, including staying in your home when possible, standing at least 6 feet apart for a period of time. Again, we're going to all come back together here. We're going to all come back together and practicing hand hygiene, which we should do anyway. A lot of things I think are going to spill over. Shaking hands maybe will stay with our country for a long time beyond this. One of our great doctors was telling me that, as you know, we have flus every year, and the number of people killed by the flu is very substantial. It said that if they didn't shake hands, that number would be substantially lower. So maybe it'll stay, maybe some of these things long-term will be good. But those guidelines are still the best and the safest way to avoid the infection.
Well, that wasn't the only thing that President Trump had to say about the coronavirus. While the United States is battling the deadly coronavirus outbreak, President Donald Trump holds China responsible for the current global health crisis. Now, at a White House press conference this week, the U.S. president said, "World is paying a very big price because China held initial information about COVID-19 outbreak after it began in Wuhan in January," which is contrary to what the Chinese spokesperson just said, how they explained their very thorough and decisive actions that they took.
Right. Well, Trump claims if China had shared the information they had obtained earlier, the virus could have been contained there. where it originated, and the world wouldn't have to be inflicted by the deadly virus. Recent studies have revealed that transmission from individuals who do not show symptoms is playing a more significant role in the spread of the virus than previously thought. So, you might not be symptomatic, but still transfer it.
President Trump addressed the public on another measure Americans can take to help prevent the spread of COVID-19. He said, in light of these studies, the CDC is advising the use of non-medical cloth face coverings as an additional voluntary public health measure. Now, Trump emphasized that this is strictly a voluntary measure to take.
President Trump added, the new mask guidelines also do not replace CDC's guidance on social distancing, including staying in your home when possible, standing at least 6 feet apart for a period of time as well. The president reassured the public that we would be coming back together again in the future.
However, he ended by saying, one of our great doctors was telling me that, as you know, we have flus every year and a number of people are killed by the flu. The number of people killed by the flu is very substantial. They said that if they didn't shake hands, that number would be substantially lower. So maybe some of these things long-term will be good, he said. But those guidelines are still the best and the safest way to avoid the infection. So he was actually saying, and of course we found that out, that not using proper hygiene, not washing of hands, and that close contact, actually the close contact that, as President Trump said, doesn't really need to be there, like shaking of hands, is what is very much contributing to the spread of the COVID-19. And even before then, the regular seasonal flu that was going around, that did take a number of lives each year as well. So interesting, though, that many people, as we've reported, the scientists are still looking for a cure to try to find. They're running tests, they're trying to find vaccines, so far unsuccessful. And interestingly, Yisrael Hawkins has, somebody wrote in and asked him the question, knowing that he has spent years and years studying the scriptures, knowing what the Bible says, what the prophecies say about this very time period, and he has an answer for us coming up. So you will definitely want to hear the answer, or you could say the cure for this COVID-19.
That's right. And in the meantime, if you are interested in finding out more information about the House of Yahweh and their teachings, you can write the House of Yahweh. And of course, when you do, don't forget to request your free copy of the Prophetic Word magazine and the monthly newsletter. You can write them at the House of Yahweh, P.O. Box 2498, Abilene, Texas 79604. You can call the House of Yahweh at 1-800-613-9494. Visit them on any of their websites by going to Yahweh.com, YisraelHawkins.com, and Yahweh'sBranch.com. You can also visit our website by going to YPNnews.com. You can email the House of Yahweh at info@Yahweh.com. And for all calls outside the United States, please dial the number on your screen. And of course, as we've mentioned in past times, don't forget the free online programs that will aid you in understanding the scriptures and the prophecies. And that's by going, you can find that by going to the Yisrael Says program by going to YisraelSays.com, or the Ask Israel program by typing in AskYisrael.com.
Well, for all of you who are writing in and asking Yisrael Hawkins of the House of Yahweh, what's the cure to the COVID-19? Your answer is coming up. Don't go anywhere. Up next is Yisrael Hawkins. From all of us here at YPN News, I'm Jeffrey Heimerman.
And I'm Katan Alexander.
Thanks for watching.